Welcome back. I'm Rachel, and in this video we're going to go over the structure of the lunate bone. This bone is also known as the semi-lunar bone. The lunate bone is located in the wrist region of each hand. If we look more closely at the dorsal view of the right hand, which is the back of the hand, we can see here highlighted in red the lunate bone is located in the middle of the wrist. If we now look at the palmar view, we can see it again highlighted in red amongst the other wrist bones. Now we are going to look at the different landmarks and features of the lunate bone. Here we have the distomedial view and the proximolateral view of this bone. This bone is crescent-like in shape and has 6 surfaces. The first 2 surfaces are the palmar surface and the dorsal surface. Both of these surfaces are roughened for ligament attachment. The third surface is the proximal surface. This surface is convex in shape and has an articular surface for articulation with the radius bone and the articular disc of the distal radio-ulnar joint. The fourth surface is the distal surface. This surface is very concave in shape and has a facet on it for articulation with the capitate bone. The fifth surface is the lateral surface. This surface has a semi-lunar shaped facet on it for articulation with the scaphoid bone. The sixth and final surface is the medial surface. This surface has a facet on it for articulation with the triquetrum bone. A curved ridge is found between the distal surface and the medial surface that has a facet for articulation with the hamate bone. Let's now take a closer look at the articulations this bone has with other bones. This bone articulates with 5 other bones. The first of these articulations is with the triquetrum bone. The facet on the medial surface of the lunate bone articulates with the facet on the lateral surface of the triquetrum bone. The second articulation is with the hamate bone. The facet on the curved ridge of the lunate bone articulates with the facet on the proximal surface of the hamate bone. The third articulation is with the capitate bone. The concave facet on the distal surface of the lunate bone articulates with the facet on the proximal surface of the capitate bone. The fourth articulation is with the scaphoid bone. The semi-lunar facet on the lateral surface of the lunate bone articulates with the facet on the medial surface of the scaphoid bone. The fifth articulation is with the radius bone of the arm. The facet on the proximal surface of the lunate bone articulates with the articular surface on the distal end of the radius bone. What about the muscles that attach to this bone? This bone actually has 0 muscle attachments. And that concludes this video on the structure of the lunate bone. I hope you found it helpful.
Thank you for watching. If you want to support this channel, please subscribe and check out more of my videos.